don't deny that there are side effects, but then most of the side effects, I must say, are manageable. There are few side effects like visible side effects, for example, hair loss. That is something we kind of reassure the patient, saying that even if there is hair loss, it would definitely grow back. So that is in a way reassuring them that whatever side effect happens visibly in terms of their physical appearance is going to be temporary. It is not a permanent hair loss.
Yeah.
But unfortunately, we do not have any treatment per se to prevent hair loss.
Right.
So that is one very common side effect. Second commonest would be they would have some amount of altered taste, so that again affects their appetite. But apart from that, earlier there would be a lot of nausea. They would always feel like vomiting, aversion to food. But now we have very good medicines which we do pre-medicate. So by using those medicines, they do not have nausea and vomiting. That the incidence of those side effects has drastically come down with these medicines. There wouldn't be any doubt that we are offering them whatever is the best possible for that particular patient, be it in terms of surgery, radiation, medical oncology, any form of treatment in oncology. What we offer is definitely at par with the global standards. And India per se, I would definitely say that the cost of treatment here is far less than what it is in foreign countries.
You also mentioned about the molecular biology. Right? What are those, and how they are different from the traditional chemotherapy we are talking about?
Immunotherapy is like the star kid now in medical oncology. So what we try to do by using immunotherapy is that we try to make the immune system again recognize these cancer cells and fight against it. So there, the main modality of tackling these tumor cells is the patient's own immune system.
Okay.
So the advantage of this is like the chemotherapy side effects which we just discussed about.
Yes.
That is seldom seen. Those side effects are not there at all.
Hello and welcome to the Care Compass. I am your host Subodh Simha, and in this episode, we explore the world of medical oncology, where science, skill, and compassion come together to save lives. Joining us today is Dr. Vinayak Munirathnam, Senior Medical Oncologist at Shri Shankara Cancer Hospital, Bengaluru, India. Dr. Vinayak, welcome to the Care Compass. It's a pleasure to have you with us today. To begin, could you share a brief overview of your background and professional journey, Doctor?
Thanks so much, Subodh. Thanks for this opportunity. So I am Dr. Vinayak. I'm a senior consultant in medical oncology here at Shri Shankara Cancer Hospital. So I have done my MBBS from Dr. B.R. Ambedkar Medical College here in Bangalore. And then I went on to do my MD at MS Ramaya Medical College. And then I worked for some time at Vaidehi Institute of Medical Sciences. Okay. And then I went on to do my DM in medical oncology at Amrita Institute of Medical Sciences, that is at Cochin. So I also had the privilege of doing a short fellowship in Japan that was in transplant and also in precision medicine and solid tumors. So that also gave me some good exposure there.
Wonderful, doctor. Curious, right? So what drew you towards specializing in medical oncology? And our viewers also would love to hear out from you at what inspired you to take this path.
The thing is about medical oncology, most of us during our undergraduation and even during our post-graduation, we are not actually exposed to medical oncology. We might be seeing few references here and there, but we actually do not come across the field. So that is something which has always been very curious to us because one area where there is too much of uncertainty has always been oncology. And also maximum or the most of the development which happens in medicine, maximum number of research studies which happen, everything goes on in medical oncology or oncology per se. So that has always been an area which has caused a lot of curiosity in me as well. So, but then to be very honest with you, it was not out of pure choice that I ended up taking medical oncology. But given the few options which I had when I really had to choose, then probably these factors where there is vast amount of research happening, a lot of uncertainty, and it is also a field which tests the resilience of a patient and also the entire family per se. So
Okay.
it is a kind of mix of science, empathy, hope,
Yeah.
two things
Compassion.
which go
Right.
on compassion. Yes, exactly,
Correct.
in
Yeah.
oncology. So
Mm-hmm.
probably all these things kind of, in a way, led me to decide upon taking medical oncology.
Most of us, since we don't know what exactly, we are not familiar with, what medical oncology is. Essentially, what exactly medical oncology means and how does it differ from the surgical oncology?
See, in oncology,
Yeah.
we have mainly three specialties if you look at it with the treatment perspective. So
Yeah.
one is medical oncology, surgical, and then we have radiation oncology.
Yeah.
So surgical oncology, as the name itself suggests, has to do with surgery. So
Mm-hmm.
wherever tumors can be resected or a patient can undergo surgery either with a curative intent or for palliation purposes,
Okay.
that is dealt with surgical oncology.
Right.
There again, that is a very vast modality where they do open surgeries, laparoscopic. Now, like in our center, we do a lot of robotic surgeries as well.
Yeah.
So that field again is very advanced now. So that is surgical oncology in brief. So, and medical oncology is to do with medicine. Chemotherapy, I think you all already know.
Yeah.
Chemotherapy is like a broad term for all the drugs which are used in oncology.
Right.
So this has been there for quite a few years now. But what has happened is, as science has advanced, there have been more and more research that has been happening. So
Mm-hmm.
we have moved on to now immunotherapy, a lot
Mm-hmm.
of advancements in immunotherapy, and then molecular oncology. Molecular oncology again has to do with the molecular biology of the tumor per se. So
Okay.
there we study the tumor biology in detail and then decide upon what treatment would be best for that particular patient. So
Mm-hmm.
that is again a part of precision medicine. So all these things come under medical oncology.
Okay.
And radiation oncology is to do with radiation per se. So that
Okay.
is again loco-regional treatment which they do,
Mm-hmm.
and a lot of advances have happened in radiation, especially with the medicines, with the way they contour, and there is not much of scatter in radiation that happens. So the side effects have come down drastically, and they can exactly pinpoint as to where the lesions are, and they can radiate. So a lot of advancements there. And again, I must say that we are fortunate enough to have all that technology here at our hospital at Shri Shankara. We do have all of that.
So
So
for
in
from
a
the
broader
layman's,
sense,
yeah, yeah.
this is
Go
what
go ahead.
we
Sorry. Yeah.
right. No, I was saying that in a broader sense, these are the main specialities.
Yeah.
But then we always have oncopathologists. Without them, we will never reach a diagnosis. So pathology
Okay.
again plays a very, very important role
Right.
in oncology.
The biopsy
And
and all, right?
even
PET scan. No, not the
exactly
biopsy. Right.
the
Yeah. Okay.
biopsy,
Mm.
and then the
Mm.
radiology people who help us with the
Radiology.
scans, the
Mm.
staging.
Mm.
Molecular oncology, again, I did stress upon
You did
molecular
stress. Yes.
biology.
Yes.
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 So that is again, that is something very key now to treatment. So that is very important as well.
Beautifully explained, doctor. So, which treatment usually comes first, and how is it decided? It's medical oncology or is it surgical oncology?
To put it in perspective, like if a patient walks into our hospital, for example,
Yeah. Mm-hmm.
what we do is we first look at what the diagnosis could be. Now,
Mm-hmm.
how we reach a diagnosis is we biopsy a particular lesion. And now, say,
Mm-hmm.
for example, if there is a breast lump, we would go ahead and biopsy it to see what type of a breast lump is it. Most of
Okay.
the cases where breast lumps could be benign or any lump for that matter. It could be
Okay.
just a benign lesion which is not malignant at all.
Mm.
So we have to confirm it is a malignancy. And once we confirm, we have to stage the patient. So staging happens with the PET scans or any scan for that matter. So scans are done mainly to stage the disease as to what the extent of the disease is. And depending on the stage is how we decide upon the treatment. So now, for example, if a patient is in a very local stage, or say if the stage is local, or if it is locally advanced, or if it is in a very early stage, Then surgery or surgical oncology reference would be important there. So
Mm-hmm.
surgery becomes the first modality of treatment in most cases. And if it has, at surgery, we look at the pathology report and see how severe the disease is. And then we decide whether to give radiation or to do or to give them chemotherapy or any other systemic therapy. So this is how the treatment goes.
Okay, so that brings us to another important aspect called the staging the diseases, right? What exactly it means?
Stages meaning now, for example, since I did take up an example of breast cancer.
Right.
So say if a lump is in one particular area, it is usually staged as early stage. So could be stage 1, could be stage 2. And usually what happens with the tumors is they spread to the nearby lymph nodes. All right.
Mm-hmm.
So the tumors, they either have a hematogenous, that is they spread through the bloodstream, or most often they spread through lymph nodes.
Okay.
So if a particular tumor has gone to a nearby lymph nodes, so there it could be stage 2 or it could be somewhere around stage 3. If it has gone beyond the lymph nodes, like for example, if it has gone to any other organ, from the
Yeah.
breast to the bone or to the lung or to the liver, then it becomes stage 4. So it mainly it gives us an idea about the extent to what the disease has spread.
All right. So is this how the stage has been evaluated? 1, 2, 3, and 4, like that? That is what.
Yeah. We have 4 stages. We do have sub-classification now, just to make it all the more, precise. But broadly, it will be 1, 2, 3.
What type of cancers you have come across in your, the past several years of experience that you have here, and typically what you see, common cancer types and all?
Commonest what I see would be breast cancers, lung malignancies, and gynec oncology, that is cervical cancers, ovarian malignancies, uterine malignancies. So these would be the commonest which we see. So that is how the incidence has also been in our country. So we have breast, lung, cervical malignancies as the most common, but then we do often get other patients as well. We get sarcomas, we get brain tumors, we get lymphomas, myelomas, so many others. But a vast majority would be these malignancies which I mentioned.
You just talked about the chemotherapy, which is traditional therapy or treatment, comes under the medical oncology only, right? People still have apprehension about it. As when you talk about chemotherapy, it gives a lot of fatigue and all. There's a lot of side effects of that, and a very lower survival chances and all. How do you overcome this apprehension when the patient approaches you and build the confidence in them?
So as you very, very rightly put across, this apprehension is there in almost every patient. So they are very dreadful of chemotherapy. One is the term cancer itself would have put them down. And to top it all, when we suggest chemotherapy, they are very reluctant and they are there's a lot of apprehension. They're very scared, especially about the side effects.
Yeah.
So I don't deny that there are side effects, but then most of the side effects, I must say, are manageable. There are few side effects like visible side effects. For example, hair loss. That is something we kind of reassure the patient, saying that even if there is hair loss, it would definitely grow back to whatever the current state is. So that is in a way reassuring them that whatever side effect happens visibly in terms of their physical appearance is going to be temporary. It is not a permanent hair loss. But unfortunately, we do not have any treatment per se to prevent hair loss.
Right.
So that is one very common side effect. Second commonest would be they would have some amount of altered taste, so that again affects their appetite. But apart from that, earlier there would be a lot of nausea. They would always feel like vomiting, aversion to food. But now we have very good medicines which we do pre-medicate them. So by using those medicines, they do not have nausea and vomiting. That the incidence of those side effects has drastically come down with these medicines. But few of the side effects which are there And as you rightly mentioned, fatigue after chemotherapy.
Yeah, yeah,
So these things are still there, though the formulations of chemotherapy has improved. So
yeah.
there has again been a lot of advancement in that as well, and
Right.
also supportive medicines which we do give along with chemotherapy. But irrespective of all that, they still have some amount of fatigue. But
Yeah.
one way of reassuring patients is that whatever be the side effect, most of the cases they are very much manageable. And
Mhm.
it has also got to do with how the patient accepts it. So if they take it in the right spirit, that these side effects are going to be temporary and then they can overcome all this. So that makes it a lot more easier for them to take treatment.
You just now talked about the innovation in the medicines and all, right. I recently come across an article from Tata Memorial Hospital which talks about some drug called carboplatin, where that
Yes.
is added with the chemotherapy drug. I think the chances of survival is very high, and at the same time it doesn't give that kind of a side effects we're talking about just now, right? Any thoughts on that,
Yeah.
doctor?
The
This
carboplatin has actually been there
platin.
for a long time. Yes.
Yeah.
And platinums, that again comes under a class of chemotherapy drugs called platinums.
Yep.
So again, yes, as you rightly mentioned, it is a part of most of the chemotherapy regimens. It is well tolerated, except for few issues with the neuropathy where they have some tingling, numbness issues like this. It is a drug which is a part of most of our regimens. So we very commonly use this medicine as
You talked about immunotherapy, and I think you also mentioned about the molecular biology, right? I mean, molecular, I think at the
well.
beginning
Yes.
of the conversation and all. What are those, and how they are different from the traditional chemotherapy we are talking about?
See, immunotherapy is like the star kid now in medical oncology. So what people did realize was that eventually it is the immune system which fights anything foreign to our body, be it an infection or be it cancer. So only difference between an infection and a cancer cell would be cancer in a way it is quite a clever cell. So it has a way of evading the immune system. So the immune
Okay.
system does not recognize this as a foreign cell or an abnormal cell. So that is how these cells somehow evade the immune system. They try to survive and then they proliferate and become large lesions.
Right.
So what immunotherapy per se does is this mechanism where the tumor cell kind of switches off the immune system from recognizing it. So that is something which is inhibited by using this immunotherapy. So what we try to do by using immunotherapy is that we try to make the immune system again recognize these cancer cells and fight against it. So
Mm-hmm.
there, the main modality of tackling these tumor cells is the patient's own immune system.
Okay.
So the
Okay.
advantage of this is like the chemotherapy side effects which we just discussed about.
Yes.
That
Yes.
is seldom seen. Those side effects are not there at all.
Okay.
Only side effects with immunotherapy would be probably since we are trying to harness the immune system or potentiate the immune system, there could be some amount of immune related side effects, which
Mm-hmm.
are again very much manageable. And another very important thing about immunotherapy is chemotherapy always are restricted to the number of cycles we use. We cannot continue using chemotherapy like until progression or for a very long time. Immunotherapy, that way, you can continue using it as long as the patient is responding to immunotherapy. So
Okay.
that is the advantage of immunotherapy. Yeah. So now it forms a part of almost the treatment of every cancer cell.
Okay. Okay. And there is something called target therapy also, right? I mean, it's very similar, which is
Correct.
doesn't fall under the category of chemotherapy. Something that, what exactly it is? I mean, when you say target
Yeah.
therapy,
Targeted therapy is
yeah,
the what we
targeted
do
therapy.
now
Yeah,
is
yeah.
yes, we look at the tumor biology. So
Okay,
what our molecular scientists do is they look at the DNA framework of a particular tumor cells, look at if there have been any mutations or any deletions or anything abnormal going on with the tumor DNA per se. And they also look at there are few receptors on the cell surface of the tumors.
Okay.
So what these receptors do is they are like a growth pathway. So anything that triggers of these receptors will eventually make the cell proliferate. So what the molecular scientists or the next gen sequencing which they do, next gen sequencing is a platform where they look at all these alterations which happen. So based on that, we find out if there is a particular target or if there is a particular pathway that this tumor cell is relying on. So if the tumor cell relies on a particular pathway for its own growth, and if we have a molecule which can target or inhibit that particular pathway, we use that or we suggest that for that particular patient. Now, this target could be different for different patients. Now, if there is a particular patient of lung cancer, for example, different patients could be having a different type of a molecular alteration. So each would be on a different kind of a treatment.
Okay.
So this is targeted therapy. So this is basically precision medicine. If you can put it as a broader.
Okay. So while we are on this, does Shankara has the facility to provide all this treatment about immunotherapy, target therapy, chemo anywhere? Every cancer hospital has it, right? So it's traditionally been done. Okay.
Yes. So it's not that I'm here, but then to be very honest with you, we are very fortunate to have a very good molecular oncology team here. We have a team of researchers, very senior scientists, and we have the best of equipment with respect to NGS, that is the next gen sequencing. So where they, look at the entire DNA framework. So we have very extended panels which we have. So even something very rare or not very common, even such mutations or DNA alterations or RNA-based studies also are going on in our research lab. So that way we do not outsource anything. Anything to do with molecular oncology, we do it in-house. And the best part about doing it in-house is most of the turnaround time of these reports for us is very fast. And they are very approachable. So we have a very good system here. So we do discuss everything. We have separate molecular oncology discussions itself. So we get the reports very fast. Apart from that, it is not just one person deciding. So it will not be only me who decides. We do have a detailed discussion with the molecular scientists here. And then we come to a conclusion as to what is best for the patient. So that is something which is very, very good about what we do here.
So doctor, now I'm curious, right? You have a traditional chemotherapy, you have a immunotherapy, you talked about a targeted therapy, right? What decides to choose which one to go for a given patient case?
I mean, chemotherapy, as I mentioned, is more of a blanket treatment. So the idea of using chemotherapy is the principle of chemotherapy itself is that it acts on cells which are rapidly dividing, right? So if a patient is having a tumor cell which is actively growing, we would want to use chemotherapy just to make use of that particular benefit where it downsizes the tumor rapidly. And immunotherapy and targeted therapy, we do try to, do these tests parallelly. So once the patient is on treatment, the chemotherapy acts quite fast. So the symptoms of the treatment do come down, the tumors downsize. And then based on these biomarkers which we test for immunotherapy and also for molecular oncology. So based on the molecular markers and the biomarkers for immunotherapy, we try to add immunotherapy, and in certain patients, if there is an option of targeted therapy, we add that as well. So once the number of cycles which we plan, chemotherapy, like for example, 6 cycles or which get over, then we continue the patient on either the targeted therapy, depending on his molecular signature, or immunotherapy. So this is how we decide on treatment as on today.
Okay. Well, so doctor, there are several specialists, as I understand, if I hear out you, right, working together. I mean, therapists, surgeons, and there'll be a pathology department also, right, for a patient case and all. Yes. How do they collaborate to come up with the individualized plan? Because I think the treatment plan would vary from patient to patient. It will not be one generic thing, right? Each patient will have a that's what individualized treatment plan. So how do they collaborate?
So as I mentioned, we do have these molecular tumor boards or molecular meetings which we have.
Okay.
So
Right.
once we send a patient's sample for a molecular marker, so we arrive at say, for example, it is called a molecular signature of that particular tumor type. So we do have these meetings where we discuss what is best for him. So even the pathologists join us because the first step to a diagnosis is always from pathology. So the pathology department doctors and we do have a very good team here, I must say, who subspecializes. They are experts in one particular field, like for example, breast, lung, gynec oncology. So they all specialize in specific subsets or subtypes of tumors. So they also sit with us depending on what type of a tumor type we are discussing on, and they do tell us what is best and what they have come across when they have been looking at the pathology report. So we do have a very good discussion involving all these people. So that way, when we arrive at a diagnosis, even we are confident in a way as to, we are offering the treatment, whatever is best for him. So discussing with the entire team always helps the patient.
Okay, so the patient really has a whole ecosystem supporting him
Yes.
for the cause, right? Because there's a larger crowd there. Because for him, he may not see the entire thing in the backdrop,
Yes.
right? So that's beautiful.
Yes.
A lot of doctors there, and which the patient may not even realize that, right? So
Yes.
may not know about it. Patient or patient. That's wonderful.
Yeah.
How do you see India as a destination for the cancer care, and particularly Shankara Cancer Care Hospital? Now you have two different hospitals, right? One in Bangalore, other is in Bhubaneswar, right? And for particularly for the patients who come from Bangladesh and African countries and Middle East and all to explore the treatment overseas, right? So,
Yes. One thing I must say is whatever we offer a patient, I have already told you our work atmosphere and how we approach a particular patient. So there wouldn't be any doubt that we are offering them whatever is the best possible for that particular patient, be it in terms of surgery, radiation, medical oncology, any form of treatment in oncology. What we offer is definitely at par with the global standards. And India per se, I would definitely say that the cost of treatment here is far less than what it is in foreign countries. And I have also had the privilege of working and also having some exposure in different countries. So the cost of treatment there is immense. It is very huge, and hardly anybody can afford unless they are covered with insurances. So we offer them the same treatment at a much lesser cost here in our country. And another best part is the rapidity at which treatment starts. We are very fast in starting a treatment patient on treatment. So the
right.
time to diagnosis, time to starting treatment in India is extremely fast as compared to other countries.
The waiting time problem is there, right? So
yeah, they have a huge waiting time, and they have a system which takes a very long time.
True.
So that way we are far better. Yes. No, I was just saying that earlier we wouldn't. There were few treatment which people here in India we didn't have access to those treatment options. But now whatever is available globally is available here in India.
Correct. Yeah. What should the international patients keep in mind when planning such a journey? Assume it's going to be India as a destination in their minds and all, right? What should they?
See, one thing for international patients would be one is they can be rest assured that they are getting the best treatment at par with global standards. So there wouldn't be anything which we do not have. And fortunately now even medicines which were not which we didn't have access to earlier, we do have access to whatever is there globally now. So be it in terms of our surgical expertise or the instruments, robotic surgeries, the type of radiation machines that we have, And the systemic treatments which we offer, like the chemotherapy, immunotherapy, or targeted medicine, we have access to everything. And the best part is we offer the same standards at a far lesser cost than what is charged abroad.
Right.
And apart
Very
from
true.
that, the time to starting treatment is much faster here in India, as we had discussed. So that is again, there wouldn't be a delay in their diagnosis at all. So
Correct.
everything would happen very fast, and initiating on treatment as well would be fast for those patients. And we do recommend whatever is the treatment for them, and it is given in a written format. So even if the patient wants to go abroad back to his country and continue a certain treatment which we have started him on, he can do that even there as well. So we
Right. Right.
do give them a detailed summary, recommendation as to what needs to be done.
That's really helpful advice, doctor. Before we wrap up, what message would you like to share with all our viewers, the patients, patient family, or anybody, as a matter of fact?
Message I would want to tell everybody is that even including the patient's relatives whom I come across, is awareness is the key. It is
Right.
not just about cancer per se. Awareness about one's own health is the most important thing. And that is something we all have to bear in mind. Being aware about our own health, trying to have a very good lifestyle. We all know what is harmful for us. Be it in terms like we come across so much in the news or people talking about it. So everybody knows what is good and what is not bad for them. So being aware of that fact and trying to make those modifications where you have a healthier lifestyle, that will go a long way in preventing all these problems, including cancer. And another thing is, even if you find anything which is minutely going wrong with you, any small symptom which you would want to neglect, considering it
Yeah.
to be very small, don't do that. Try to take medical help. Just ask them what it could be, and they will always guide you in the right direction. So people somehow are kind of scared about going to a hospital now because they feel there would be so many tests which are done, so they avoid going to the hospital entirely. But then I would definitely advise that they should seek medical help. What happens is, majority of the cases, the symptoms are benign, meaning it is harmless, it has nothing to do, it will not cause any harm to the patient. But a few cases where the symptom, however small it may be, might be something very significant, and seeking early medical attention would probably cure them of that problem and avoid long-term complications. So
Complications.
keeping
Yes.
that in mind, I think everyone should be aware of one's own health. So that is something I would really want everybody to be aware and practice.
Thanks a lot, doctor, sharing a wonderful insights. And we talked about a complex topic like cancer and the treatment, which was very in a simplified way you explained, and also in a very reassured way. Thanks a lot, doctor. Thank you.
Thank you. Thanks so much, Subodh. Thank you.
Hope you found this conversation meaningful. Don't forget to like, share, and subscribe. Your support helps us reach more people seeking trustworthy health guidance. Until next time, stay informed, stay healthy, and take care.